Hi, everyone. Welcome to another episode in the oDoc series. Today, we have something very interesting to talk about and something that I think is very, very important to be spoken about openly. So, to start off, sex and anything to do with sex, including sexual health, is treated like something extremely bad and disgraceful in most parts of our society. But however, it shouldn't be that way. Sexual health should not be a taboo topic. In fact, it should be something that everyone talks about openly, and we should be spreading awareness about it without feeling guilty. To shed some light on sexual health, I am extremely honored to have Dr. Kulasiri Buddhakorala with us today. He has over 38 years of experience in the field of clinical and public health management of sexually transmitted diseases and 15 years of experience in the care and treatment of HIV/AIDS. Dr. Kulasiri has been a lecturer for undergraduates and postgraduates in 3 medical schools in Galle, Colombo, and Saitam, Malabar since 1983. He's also the chairperson of the Board of Study in the Venereology and the chief examiner for sexual health and HIV medicine for a period of 7 years running. Doctor, it's an absolute pleasure to have you with us today to talk about sexual health and to spread awareness to everyone listening in today.
Yeah, I'm pleased to join you. Thank you.
Thank you, Doctor. Before we go into the questions that I have, Doctor, I would like to let all our viewers know that if you guys have any questions that you all would like to ask Dr. Kulasiri, please feel free to send it to us via the comment section below. But in case you want to ask the question anonymously, you can do so by sending us a DM on either Instagram or on our Facebook page. If time permits, I will definitely ask Doctor those questions.
Yeah.
Doctor, jumping straight into the first question I have. What is sexual health? How important is it to be informed of this? And also, do men and women both have to look out for this, or should one gender give more importance to sexual health than the other?
Okay, well, I think the best answer to this is what the World Health Organization says. There's a very clear definition from the World Health Organization. I quote, "Sexual health is fundamental to the overall health and well-being of individuals, couples and families, and to the social and economic development of communities and countries as well. Sexual health, when viewed affirmatively, requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. The ability of men and women to achieve sexual health and well-being depends on their access to comprehensive, good quality information about sex and sexuality. Knowledge about the risks they may face and their vulnerability to adverse consequences of unprotected sexual activity. And also ability to access sexual health care and living in an environment that affirms and promotes sexual health, unquote. At the same time, sexual health related issues are wide-ranging and encompasses sexual orientation and gender identity, sexual expression, relationships, and pleasure. They also include negative consequences or conditions such as HIV infections, sexually transmitted infections, and reproductive tract infections, and their adverse outcomes such as cancer and infertility. And also, it has a negative effect on unintended pregnancy and abortion, sexual dysfunction or erectile dysfunction, sexual violence, and harmful practices such as female genital mutilation. But this is a kind of practice not in our country, but in sub-Saharan African countries. So those are the negative consequences of sexual health. Yeah.
Great, Doctor. Thank you for shedding some light on that. I think it's really helpful. Even your quote from WHO, really, really helpful. Thank you for that, Doctor. Just stemming from your answer, you were talking about HIV, which is a very commonly known disease that everyone talks about, but I don't really think people know the actual essence behind it. So what exactly is HIV and how do people get it? Most importantly, can HIV be cured at any stage of the illness?
Yeah, well, HIV, uh, the stand for human immunodeficiency virus. So that is a virus which was discovered in 1983. And if when it goes to full-blown the disease status, it is known as AIDS, that is acquired immunodeficiency syndrome, where the patients were encountered somewhere in 1981. So the HIV status of a person can be identified, I would say 6 to 12 weeks after the sexual encounter by doing a normal HIV antibody test, which is available any part of the country. And you want to know the disease spectrum of HIV/AIDS as well. Well, soon after a person acquires HIV infection, it will be a more or less asymptomatic stage. So which is known as no symptoms, no problems at all. The person is infected, but the person thinks, I'm okay. I had some, bad encounters, but I'm okay. But this stage will go on maybe 4 to 5 years. But remember, during that period, whenever that infected person is having sexual relationship with a non-infected partner, only there is a possibility that he or she can transmit the disease. And you ask HIV cure, we are dealing with the viruses, we know the present, the havoc we are facing. So there's no cure, but there is some, theoretically, 1 or 2 people in the world got cured, but those are very high-end kind of situations. But definitely, by giving antiretroviral drugs, we can eliminate the virus almost, but not completely. So we started our HIV treatment care program 2004. Actually, I'm very happy to say I was one of the first kind of care providers at that time. Not anymore, of course, since my retirement. But we cannot talk about HIV cure, but definitely he or she will have a very positive life. In fact, he or she can, a female patient can get pregnant and can have children, remember, free of HIV. Yeah.
Great, doctor. Thank you for that. And it's really great, that you were part of that research. I have a question that stemmed from your answer. You said that you can do the antibody test for HIV. I just want to know if those tests are readily available as in Sri Lanka, or is there any specific hospital that patients need to go to, or can they just go into any hospital?
Yeah, now any government hospital where the sexual STD or STI care is available, we call STD clinics or STI, sexually transmitted infections or sexually transmitted diseases. The clinics available throughout the country. Every district there is a hospital or a clinic, I would say. But at the same time, major private hospitals and some other care providers in the private sector will also offer this HIV antibody test. It's a very simple test. We have third or fourth generation tests available, very sensitive test. So this test is known as a screening test. Just because it is positive, it does not mean the person is confirmed with the disease. But of course, then we have to take another sample and we send it to our central STD laboratory. Then only it is confirmed. Yeah.
All right, doctor. Thank you for that. Thank you for giving us that piece of information. So you were mentioning that there are so many STD clinics and stuff, but what are the most common STDs in Sri Lanka, and which gender is most vulnerable to these diseases?
Yeah. Now, when you say gender, we mentioned that at the very beginning that equally male and females are vulnerable. But when we talk about gender identity, we have this heterosexual, of course, sex with a man and a woman. And then we have certain subpopulation, actually, which is a very common name. We know that LGBT community. So that is LGBT stands for lesbians, gay, bisexual, and transgender. Of which gay and bisexual, including transgender, they are very vulnerable to STDs as well as HIV infection. In fact, the first few cases in the US were identified among the white gay population in the California state. Other than gay community, there is another kind of course, gay community, certain people can be identified, by a clinician or by a care provider. This person could be the gay person. But there is another category of bisexual. They are married, they are having female sexual partners, but they are having homosexual, or I wouldn't say that word, the gay practices as well. So this is a kind of a very high risk behavior, because their character and their the sexual activities are quite vulnerable to that person itself, or they are the recipients of their sexual practices. Yeah.
All right, Doctor. Thank you for that. If you don't mind, Doctor, we've got a question from one of our viewers. Can I take that?
So go ahead. Yeah.
Yeah. So the viewer has asked, I would like to know from Dr. Kulasiri, how different is syphilis from gonorrhea clinically? What are the differences?
Since that person raised the question, we can go into the STDs, sexual transmitted diseases or sexually transmitted infections. Now, sexually transmitted infections can be broadly divided into, or we will come across these patients with two broad categories. So first set of patients will come and say, I have a sore, I have a wound, or we call it ulcer. This is known as genital ulcer diseases, or GUD, of which syphilis, chancroid, and genital herpes, those are the three main diseases. But syphilis and chancroid are not very much prevalent in this country right now, for that part, many parts of the world. But of course, the killer disease, I would say, the silent epidemic is the genital herpes. So then that person asked whether the gonorrhea and syphilis. So syphilis is their clinical presentation is genital ulcer, but gonorrhea, chlamydia, trichomoniasis, and some other minor diseases, the patients are presented with a discharge. They say, I have something coming, some liquid or something coming from my genitalia. In the case of male patient, from the urethra. In the case of female patient, they might say it's coming from the vagina. And at the same time, there are some other associated symptoms. Those are the two kind of categories. But at the same time, there's another presentation of these STDs. They wouldn't say, I don't have an ulcer, or I don't have a wound or sore. I don't have a discharge, but I have some kind of a growth, So when you look at it, there is something coming out from the genitalia, the mucosa, the soft skin. So which is known as genital warts. That's also caused by a virus. Out of all these diseases I mentioned, I think I would go into little detail about genital herpes. Genital warts and genital herpes are caused by viruses, viral diseases like HIV. Genital herpes, which is a kind of a killer disease. I quote killer means not the real killing people, but it has real playing havoc among the sexually active population right now in our society. 40 years back, when I started my practice, I hardly saw these genital herpes patients. But right now, almost every person who is sexually active, who is having multiple partners, or who is having a partner who is infected with the genital herpes virus, can get symptoms. The symptoms are quite painful ulcers preceded by some blisters or fever and things like that. especially among female patients, these ulcers or these sores can cause very severe kind of disability to the patient. Sometimes I have seen, I mean, I can identify, I can spot as soon as the patient is entering into my room, the way that she walks, I can say, probably this lady, this woman is having, genital herpes or some kind of disease. So that is the real gravity of the genital herpes, because it is caused by a virus. Of course, we can treat symptomatically and we can treat them not to prevent any future episodes. But the irony is that a person who is having genital herpes, when the symptoms go away, that person thinks, I am free of the disease. But that person is not free of the disease. Person is carrying the virus. Though person doesn't have ulcers at present, whenever that person is having sexual relationship with his partner or her partner, the non-infected partner can get the virus. So that is how it is more prevalent and more disturbing in the community. I would say that, I want to quote that the United States, the federal government, their main service component, service provider, of course, the real authority is Center for Disease Control, where I had my training some time back, about 98 and 99. The CDC has identified around 16% of the general population is infected with two types of viruses in herpes type 2, that is mainly sexually transmitted. More than or approximately 54 to 56% of the general population is infected with the type 1, because those days mother gives it to the baby. It's not a sexually transmitted disease. We call cold sores, and it's not a social problem. But of course, nowadays we have seen even both viruses, type 1 and type 2, a person can get infected either one because of their sexual practices. Yeah.
Thank you, Doctor. Thank you for going in so much depth about that. Thank you for that. Just moving into my next question is, you've already answered this, where can STI tests be done? But my main question is, what kind of tests should be done regularly by young women and men, not even young, like anyone?
Yeah, since you raised the question, young women, I would say, young population, I would say the youth population. Nowadays, because of the social media and the free access to these, kind of contact with the other people, and also a little bit of the female population is larger than the male population, and there is a big demand for males actually from the females, and so on and so forth. They are having a kind of, I have seen serial monogamy. What I mean is they are having a relationship with with a person for a short period of time, maybe 1 or 2 years, then they are not happy, so they get onto another partner. When in this kind of sexual environment, anybody can enter into that circle, with the virus, genital herpes. So invariably, this goes, it goes a real crisis in that, community. And I have seen many people are infected with the virus. That's why I said at the beginning, herpes is a silent epidemic in this country. When I said silent, if a person is having dengue, of course, they talk very freely. Even COVID, they might say, hush, hush, that person is having this and that, but it's not a crime. But when a person is having genital herpes, it is always in privacy, and very confidentially we reveal that to another person. Even you are worried to tell your best friend, and so in these circumstances, the chances are the spreading of the disease is quite high compared to other STDs. Yeah.
All right. Thanks for that, doctor. That actually leads me to my next question. You spoke about the stigma around it and stuff. So what advice would you give a person who has tested positive for an STD, or someone who fears they may have the symptoms? What are the best practices for preventing these also?
Yeah, I would say a person who is concerned about STD, having a sexual relationship with a partner, he or she thinks, was it good? I mean, was it clean what I had? And, obviously there are concerns. So then basically, if the person has contracted any disease, these symptoms will come, the diseases which I mentioned, maybe 7 to 14 days during that period. But if not, they can go to the care provider, either government STD clinic or wherever they are available. And so the care provider, I mean, what I mean is a medical doctor, will go into the history and type of sexual contact they had, and then depending on the duration, the doctor will offer the testing. But generally, these blood tests, or we call the serological tests, will not be positive, will not identify the disease right away within very short period of time. So we have to go through the symptoms, and if there are no symptoms, we have to discuss with the patient, okay, right now, though we do the test, it might not show up the results. So best thing is maybe you can delay, but the person is concerned, you can go for a test right away. But then definitely my advice is at least 2.5 to 3 months after the last sexual contact, they would go for another blood test. Then only we can say you are almost completely free of any STDs. Yeah.
All right. Thank you so much, doctor, for covering that. Moving on to another question that I had was, given how conservative Sri Lanka and Sri Lankans are when it comes to sexual health, like I said in my introduction, what is the message you would like to convey to our youth population in Sri Lanka?
The youth population, of course, we have talked about these. Those are the people who take over the country in another few years' time, or so my message is, because of again I have to mention this social media.
Sorry, I think we're having some technical difficulties connecting to the doctor. Just give us a few moments till we rectify this. We're getting in touch with the doctor. If you can just give us 2 more minutes, he'll be with us shortly. Hi, doctor. Doctor, you're on mute.
Okay. Sorry. So my my advice or my message to the youth population is stick to one partner. And always, it's your right to know the disease status of both of you, right? Not only one person, both of you, if you have any kind of concern. And other thing is, any casual sexual relationship, always it should be protective sexual relationship. So in other words, use a condom. But I would rather advise condom is not 100%, not 100%. Definitely it is preventable diseases such as HIV, gonorrhea, chlamydia, but other genital ulcer diseases, it's not 100%. And also I will go into a little bit beyond this kind of a situation, that sexual practice I have seen over and over again. I mean, it's a very quite common, this genital oral sex, through genital oral sex. I have seen in this country, except HIV, all the other diseases can be transmitted. Please remember, because it's a very quick kind of pleasure the people are looking for. But, at the end of the pleasure, definitely you will have a suffering. That's it.
All right. Thank you for that, doctor. Thank you for that piece of advice. There's actually one more question that we've gotten via DMs that I would like to ask you. Are female condoms, do they also have the same percentage of efficacy at preventing?
Actually, the World Health Organization, the UNFPA, United Nations Family Planning Association, and all these other international agencies, they are trying their best to popularize the female condoms. But we also, try to promote that. But I would say it's not like a male who is wearing latex rubber condom. Because female condom is not latex rubber, it's sometimes polyurethane, and also it causes little noises, and people don't have the real sexual pleasure. But of course, using a condom, the male condom, that is quite a common and quite pleasurable to both parties, and sometimes you don't feel that there is a condom. So I mean, this is, the very important facts about the sexual relationship when we talk about the sexual health, right? Yeah.
Great, doctor. Thank you so much. We've come to the end of our session. It was such an informative session. It's been an honor to have you with us on today's webinar. Thanks a lot. And to our viewers, if you would like to consult Dr. Kulasiri in a more private manner, if you have any questions that you would like to ask him, you can do so from the comfort and your privacy of your own home via the oDoc app. He's practicing on oDoc. Once again, doctor, thank you so much for talking about sexual health and spreading awareness. And thank you for doing what you do on all the research and everything to do with sexual health. It means a lot to the young population. Once again, it's been an honor. Thank you so much.
Thank you. Thank you. It's a pleasure to be with you. Thank you.
No problem, doctor. Our pleasure. To our viewers, we will be back again very soon, maybe in a few weeks, with another webinar. If you would like us to speak about anything in particular, if you want us to explore a specific topic, please feel free to drop us a DM or a message on which topic you would like us to explore, and we will definitely look into it. So until then, until I meet you with another webinar, please stay home please don't go outside unless extremely necessary, and follow all protocols, COVID protocols. Be safe, and thank you so much.